Mr. Speaker, I rise today to share with you stories from Colorado, stories from real people who wanted me to share with you why we need to pass health care reform. I want to share with you the story of Joyce, Essex of Colorado. Joyce has a concern for the many families like hers that are middle income. Her families, she's concerned about families that make $60,000, $80,000, $90,000 a year. Joyce is a retired teacher with 30 years, a decent pension. Her husband is a commission salesperson. They have a daughter in college. Their health care premiums are about $1,000 a month, and that doesn't include deductible amounts, drugs and co-pays, and a TMJ disorder their daughter has. And insurance has paid none of the $2,000 that they had to pay to get her help. Right now, Joyce has 3 months of COBRA payment from their husband's job change, as well as the regular health premiums. Their husband and daughter are on a separate plan. Her plan is a retired teacher. They work odd jobs for additional income, like a lot of families. But more and more, Joyce sees medical bills taking a huge bit out of their income. And remember, she and her family are healthy and insured. Insurance, Joyce writes, is a necessary evil. Joyce writes that we should be sure in health care reform helps those of us that do not have excess money and are not poor. We help so many in so many ways in this country. Help those of us, Joyce writes, who work hard, pay taxes, and appreciate the opportunities we have living in the United States of America. Through health care reform, we will provide affordability credits. In the House version of the bill, goes up to 400% of the poverty level. For a family of four, that's up to $72,000 a year. So if a family of four is making $60,000 a year, $65,000 a year, $68,000 a year, they will receive affordability credits, vouchers that they will be able to use to choose the insurance of their choice from any of the insurance options within the exchange, including the public option. This would empower families like Joyce to consolidate, to be on the same plan, to have access to hundreds of choices where today none exists. Joyce has her retired teacher's plan, her husband switched jobs is on the employer's plan, and for their daughter, they have to pay out of pocket for one plan or the other. Families like Joyce's will benefit tremendously from health care reform. We're not just talking about the very poor. We're talking about middle-class American families like Joyce's, and reducing the cost of health care insurance and giving them the security so that they can go to bed every night without worrying about losing their health care. Thank you, Mr. Speaker.